Good morning, everyone. Will Dupree broadcasting to you from Austin, Texas this morning for another edition of the Japan 2020 live streams. Joining me this morning, as always, or I shouldn't say as always, we did a few of these about 2 months ago or so, Aaron. Yeah. Aaron Cargile is joining me here in the studio. Thanks for being here, Aaron.
Of course, Will.
Yeah.
Bright and early.
Of course, yeah, we've got our coffee right here. What I wanted to say is that, we had been doing these streams for about 3 weeks back in March and then had to cancel kind of and rethink things because the last time we all talked to you was that the Olympics were being postponed by a year.
That's right.
Yeah.
Yeah, we were all riding the wave with the unknown with everybody else, and so we were continuing with our plan to launch our Olympics Tokyo, Japan 2020 coverage, but then all of our reporting also was centered around the coronavirus and what that was doing both globally and then as it hit all of our local communities, and then we were waiting to see what the Olympic Committee was going to decide.
Yeah, and we have seen some very few headlines about the Olympics because there have been much more pressing things happening in the world. But fairly recently, there have been some developments with Japanese leaders questioning if the Olympics will even happen after all, even next year.
Yeah, I first learned about this from you, Will, as you were researching and seeing what the latest Olympics news was. All of us, of course, hoping that at some point, especially a year and 2 months from now, which is when the next Olympic Games are set to begin, that things will be somewhat back to normal and we can gather as a country and as multiple countries there in Tokyo again. But some people saying that that's even a doubt right now.
Yeah, I was pulling some headlines and some quotes from some of the Japanese officials. The president of Tokyo 2020, so that's the organizing body for Japan to be able to organize all of this, he said in an interview that the games would be canceled if the virus is ongoing and Japan would not seek another postponement, which is pretty interesting. So again, if you all are wondering when the Olympics are supposed to happen at this point, these are the next dates. So up at the top there, the Summer Olympic Games in Tokyo are now going to happen from July 23rd to August 8th next year in 2021. That's followed by the Summer Paralympic Games in Tokyo, August 24th to September 5th in 2021. And then take a look at that right there. There is a very tight timeline and turnaround for the International Olympic Committee because the Winter Olympic Games in Beijing are only going to start in February 4th, 2022. So not a lot of time there.
I just counted on my fingers how many months. That's about 6 month span, and we're not even mentioning the fact that the Super Bowl is also supposed to happen in the middle of all of this.
Yeah. A lot to happen right there, for sure. And again, another official that we had heard from was the president of Japan's Medical Association. He was saying that it would be difficult to hold the Olympics without an effective vaccine. So again, there are these different factors that they are still weighing to see if the Olympics can actually happen next year.
Yeah, and once again, we have to plan like it is happening. I was telling you, Will, just yesterday, we're here in Austin at our NBC station, and then we've got other stations that our company owns across the country, and we're live streaming this on those Facebook pages and websites right now as well. And we've got a team of 7 of us for Nexstar who are planning, and we're planning on going to Tokyo in July of 2020, and now all of that, we're told, is being postponed 1 year, but our team of 7 is still set to be together and cover the 2021 Olympic Games as well. And just yesterday, we received our new flights for Tokyo in 2021. So an email coming to us from NBC saying your flights have been rebooked, and so everything is full speed ahead as we look ahead to 2021, and we just see what happens.
Interesting. So you all are still set to go next year.
Yeah, that's right. Still have our gear. We're all shooting and editing our own video and stories as we go, and so I've still got that gear and have been using it for local COVID-19 coverage at this point. So it's come in quite handy. But we also don't want people to forget about what these Olympians have been through as they were training at the top of their game to prepare to compete in July, and many of them hoping just to make the Olympic team and had not done so yet. Some people had made the Olympic team, but most athletes had not made the team yet, and so now having to decide, do I want to put my body body through this for another year? Do I want to just keep it going? And what does that training look like? What does my life look like? And we're going to hear from some athletes and Olympians in this show this morning who had to make some big decisions. They were ready. Maybe 2020 was going to be their last or only Olympic Games, and then they were going to get on with their professional life after that. And everything, of course, was just blown up in their face. And they had to really decide, am I just going to change everything now and really change this perfect timeline that I had going?
Sure, and because it's all about timing, finding that right moment to be at your best and perform, and then this throws a wrench into everything.
Yeah.
We also want to check in and show you all the numbers, where they stand, the COVID-19 case numbers. The World Health Organization has been tracking them for the entire globe. If you take a look right there, we are almost at 3.5 million confirmed cases across the entire earth, and more than 240,000 people have now died from the virus here in across the world. Here in the U.S., if you're taking a look, the Centers for Disease Control and Prevention are tracking the numbers, and what they've done is they've changed, so they're telling us about the confirmed cases and deaths, but also updating everyone on what the new case numbers are and the new death numbers are. So at this point, 1.1 million people have tested positive for COVID-19 since this outbreak began. In the last day, though, more than almost 30,000 people, we should say, have tested positive for COVID-19. Looking at the death count, more than 67,000 people have now died from the virus, and in the last day, 1,719 new deaths have been reported by the CDC. So very unfortunate to be able to share that. Just goes to show you this pandemic is far from over, even for us here in the U.S.
Yeah, I think we have to remember that many places, even here in Austin, Texas, the economy slowly reopening. We know that's not the case in every state. And of course, every country, the situation is different. And so we've got to remember that from state to state and country to country, it looks a lot different. Just a little plug for the coverage I've been doing locally, but I've been doing stories on the local prison system, the state prison system, and the cases are still just rampant and going like wildfire inside those walls. And so there is still a lot to deal with the virus.
And that's a big concern when you have athletes that could potentially be all gathered in a very tight, confined space, living very close to each other. So, of course, that will be a concern that the Olympic Committee will have to weigh, as this decision seems uncertain yet if the games will actually happen next year. This also plays into a conversation that I had yesterday, and recorded an interview with a doctor in Syracuse, New York. His name is Dr. Stephen Thomas. He is the Division Chief of Infectious Disease at the Upstate University Hospital in Syracuse, so he's very steeped in all of this information at the moment, and we wanted to address and ask him if a vaccine is available, what that might mean for the operation of the games and it moving forward. And also, we asked him about large-scale events, period, what he thought about that, along with many of the states here in the U.S. reopening businesses and loosening some of the restrictions for COVID-19. It's a very interesting conversation. It's about 7 minutes long, so we do want to say that stick with us and listen, because he has a lot of good information to share, and we thought it would be good perspective to share for this. So let's take a listen as Dr. Stephen Thomas from the Upstate University Hospital in Syracuse, New York, talks about the COVID-19 impact. Dr. Stephen Thomas, thanks so much for joining me.
It's my pleasure. Thank you.
The Summer Olympic Games, they've been postponed until July next year, but just very recently, the Japanese Prime Minister said even that may be impossible unless the virus can be contained. What do you think must happen in order for the Tokyo Games to safely be held in 2021?
So I think what you have to remember is that it's not just athletes that are coming to the Olympic Games, right? It's the teams that need to support those athletes. It's all the support personnel from the host nation that are going to be there, and then potentially there are going to be a lot of spectators. Just for context, in the 2016 Olympics, they had over 11,000 athletes. So you're speaking about a large number of people all coming together into a relatively confined space. So I think there's going to have to be a very significant decline in the global transmission of SARS-CoV-2 that needs to be demonstrated before that people can seriously consider having that sort of gathering.
Outside of the Olympics, how realistic is it that any large-scale events can happen without a vaccine or a definite treatment option for COVID-19?
So I think in the current situation, any large gathering right now is probably off the table. Again, SARS-CoV-2 is transmitted when an infected person comes into close contact with an uninfected person. We know that this virus is transmitted efficiently. We know that it's transmitted more efficiently than influenza, and influenza causes tens of millions of infections every year in the United States and tens of thousands of deaths. So I think with that comparison and with that context, we really are not in a position to be discussing having large gatherings like sporting events or concerts of these sorts of things at this time.
Circling back to the vaccine in particular, what is the timeline for something like that being readily available to the public?
So normally, so in a non-pandemic situation, vaccines take a considerable amount of time to develop, anywhere from 5 to 10 years, and at a cost of up to $1 billion. When you have a situation like this, a public health emergency, a global public health emergency, they can move a lot quicker. I don't see there being a vaccine available for at least 18 months. But I would like to bring up this point. Vaccines are not what protect people, and vaccines are not what save people's lives. It's vaccination. And so it's not just the process of developing a vaccine that is safe and effective. It's manufacturing hundreds of millions of doses of that vaccine. It's deploying that vaccine, and then it's making sure that the people who could benefit from vaccination are actually vaccinated. So a development time of 18 months is a lot different than ensuring that people are getting vaccinated on a large scale.
A lot of people talk about a second wave happening of COVID-19 cases and maybe ensuing deaths from that. How likely is that to happen given the current situation and what all of the models are predicting right now?
So we saw this with the 1918 influenza pandemic, where many states that had jumped out early and had put social distancing policies and practices into effect and had a very low burden of disease. What we saw was that when they backed off too soon, transmission picked up again, and there was even more infections, and they had even more death than they did with their first wave. So again, SARS-CoV-2 is transmitted when an infected person comes in contact with an uninfected person. If there is still virus being transmitted in the community, and there are still plenty susceptible people in that community, then there is the potential for a rebound. And it can be anywhere from weeks to months before you see that rebound or that second wave. And we should remember that in the 1918 pandemic, the second wave was much deadlier than the first wave.
Here in our own country, what do you think about the states? And it is a patchwork of different policies at this point. What do you think about states easing restrictions about social distancing and those kinds of safety precautions?
Me personally, I don't think at this point in time that's a good idea. I think it's clear that there still is plenty of SARS-CoV-2 circulating throughout the country. People are still very mobile within the country. And again, there's a lot of susceptible people. If we look just within the state of New York, New York City, of course, was a huge hotspot for infections. And based on some of the initial serologic data, so antibody data, it looks like 80% of the population, or 75 to 80% of the population in New York, were not infected. So what that means is you still have 3/4 of the population that are susceptible to infection and could drive another epidemic within New York City. Up where I am, up in central New York, the number's even smaller. It could be anywhere from 1.5% to 2% infection, meaning 98% of the people up here are still susceptible. So I really do not believe personally that it is a good idea to take your foot off the gas, as Dr. Fauci likes to say, and open things up, because I think all you're doing is putting infected people in contact with uninfected people, and any momentum that or any ground that you did gain by your initial social distancing adherence, you're going to lose that ground.
Before we wrap everything up, I just want to give you an opportunity to add and share any advice that people out there should keep in mind at the moment.
So the advice would be to continue to practice social distancing, and I like to think of it as physical distancing because that puts a finer point on what we're asking people to do. Remember to continue the hand hygiene. We do believe that touching infected surfaces and then touching your face, your eyes, your nose, your mouth is still a very likely route of infection, and so continue to practice good hand washing and continue to practice good respiratory hygiene. So if you have to cough or sneeze, please do it into your clothing and then wash your hands. And then the last thing I would say is that if your state is a state that is starting to open up and people are starting to go back to work, please do not go back to work if you are ill. These are places where lots of people gather and people who are susceptible to infection gather, and if you're ill, then you have the potential to transmit to these people.
Dr. Stephen Thomas, thanks so much for joining us and sharing that perspective and a lot of information. Very helpful.
Thank you very much.
I don't know about you, Aaron, but there was a lot to digest from that interview and a lot to kind of be concerned about, too.
I agree. That coupled with what you mentioned at the top of our show with Japan's take and opinion of having the 2021 games.
Yeah.
You just heard Dr. Thomas say that he doesn't think a vaccine can be developed. He thinks it'll take at least 18 months. Typically it takes, 5 to 10 years, I believe is what he said. And so we are less than 18 months out from the July 2021 Olympics. So I don't get a good feeling. But obviously there's a lot of factors to take into consideration.
Sure.
So I still remain optimistic because I would like to go to the 2021 Olympics.
After all this work and the build up for it. Yeah.
Obviously not if it's unsafe for me or anyone else there, but it's going to be an interesting ride, I would say, over the next 14 or so months for sure.
Definitely. Well, let's take a turn for now. We've been trying to check in with different athletes as all of this has been unfolding. And we have a guest joining us by Skype at the moment. So I'm going to bring him in right now. This is Alex Rose, everybody. So Alex, thank you for sticking around with us for a little while and listening to our conversation. First of all, tell us how you're doing.
Yeah, no, thank you for having me. I'm doing fairly well, all things considered. When the initial news hit of the Olympics being delayed, I was pretty devastated. But, with the help of my friends, family, and my wife, Samantha, I've got a new plan now, and, we're just kind of trudging along.
And we should say what you do as a sport. So if you can explain kind of what you compete in and where people might be able to see you during the Olympics.
Yeah, of course. No, I'm a track and field athlete. So I'm a discus thrower. That's my event in there, and I compete for Samoa. So hopefully you'll be able to see me when they're covering the 100-meter final or something like that. I'll be in the middle of the field throwing plates.
And Alex, are you joining us from Grand Rapids, Michigan right now?
Yes. Yep,
okay, you're wearing a T-shirt. Sometimes it's chilly in May.
Yeah, it is kind of chilly, but I did want to wear my Samoa shirt today just to represent Samoa and let everyone know who I compete for.
Yeah, absolutely. We know that our friend, one of the 7 who plan on going to the 2020, I'm having trouble saying 2021 this morning.
I know, because it's not happening
I know.
until then.
We've been used to saying 2020, but you're good friends with Jack Doles, who is one of the 7 members of our team going to cover the Olympics, and he's covered you for quite a while now. What was your initial reaction or just feelings over the months where there was really the unknown of not knowing if the 2020 Olympics were going to happen, and how did that hit you really mentally, physically? What was that experience like?
So being a Olympic athlete, I did qualify and compete in 2016 in Rio. I'm used to being very optimistic and very confident. That's kind of how you continue to progress in a sport as years go on. So when I initially heard about the chance of the Olympics being delayed or anything like that, I was kind of brushing it off. I did not think twice about it. I thought it was another virus that we've heard about over the past 5 years that would just kind of come and go. And being in Rio, there was I believe it was the Zika virus that everyone was very concerned about at the time. So I thought it was going to be similar to that. So when the news actually came where the Olympics were delayed and I'd have to kind of make some life choices and make some big decisions in the coming months, I was very, very devastated.
Yeah.
It was it's a rough ride and a rough journey for any Olympian, just because it's not something you can look forward to every year. It's a 4-year decision every time you do that. So it was a very tough blow to take.
Mm-hmm. And here in the U.S., many of the athletes, depending on what sport they compete in, they were turning to their own entities for advice, for direction. You being an athlete from Samoa, was there much coming from that country and direction and guidance on what to do, what to think, if you were even going to go, if they were going to push forward for a 2020 Olympics, or do you feel pretty independent being here in the U.S. with dealing with this?
Yeah, that's a good question. I did feel a little bit more independent when there were still questions of whether or not the Olympics were going to happen and my decision to go, just because there aren't too many people who qualified for Samoa. I'm actually one of 2 people to ever hit the Olympic standard in track and field for Samoa. So there was a little bit more independence there.
And I'll let Will jump in. I got one more question for Alex, and then I know you've got some things you want to ask him too. But Alex, I pulled up a story from the Samoa Observer. It's from 2019, and you said that you believe you would have your best chance to shine at the Olympics maybe in 2020 or the 2024 games, and that discus throwers usually develop a little bit later than some, maybe late 20s, early 30s when you're primed. So is 2021 better than 2020?
There is a chance that 2021 could be better for me. I never trained full time, as funny as that sounds, until this past year. So I've made a significant amount of progress for the last 4 or 5 months when I've just been focusing on training. So I'm hoping that continuing full-time training leading up to 2021, I could make just as many gains and hopefully be in a position to try to compete for a medal.
Alex, since you're in quarantine with everybody else at the moment here in our country pretty much, how are you training? Are you able to do anything like that at home?
Yes, I am able to train full-time still,
Wow.
believe it or not. I'm very good friends with a local gym owner, Jeff Phillips. He owns Grand Rapids City Gym, and he stopped by and dropped off a squat rack for me. So I have 500 or 600 pounds of weights. I have a squat rack. I have a bench press. I have really everything I need to train full-time normally. I do have to make a few adjustments. And I have a throwing circle. I don't know if you can see it back there a little bit. I'll move the camera slightly. I poured a concrete throwing circle in my backyard, and I hooked a net up so the neighbors might think I'm crazy from time to time. But yeah, I continued my training for the Olympics here.
You just poured that just in the last couple of months?
Yeah, the day that I found out that the Olympics were going to be delayed, I kind of ran through a bunch of scenarios in my brain, and I knew that maybe a lockdown was coming and maybe they would close public parks.
Wow.
And I'm very glad I made the split decision at the moment to call up some buddies and pour a concrete circle.
That's impressive. Will, do you want to ask him one more question because he's unique in the fact that you have a real day job and training for the Olympics isn't necessarily your full-time thing.
Right, that's what we wanted to ask was how are you balancing all of that?
Yeah, so in December, I talked with my company and kind of all the management, and I decided to take a sabbatical leading up to the games. So for the past 2 years, I was working as a technical sales engineer for Keyence Corporation. And after the World Championships last summer in Doha, Qatar, I had the highest speed of release for my discus throw, and I really felt like I could have made the final. And my coach kind of came up to me, my coach Dane Miller, and he said, you know, if you worked as hard at this as everyone else here, if you didn't have a full-time job, if you weren't training 1,000 miles a week, you could be one of the best in the world. And that really hit me hard, and I decided that I didn't want to end my career without having any regrets. So yeah, that's why I decided to take a little break from work and then just continue to train full-time before Corona kind of mixed things up a little bit.
Alex, we have one more question for you, too. We had heard from different Japanese officials saying that if certain things don't happen by next year, that the Olympics could be outright canceled. What's your feeling about that whenever you hear those kinds of things percolating in the news?
Yeah, it really upsets me when I hear that kind of stuff, but I do take it very seriously, though, at the same time. I think that COVID-19 has forced us to halt expectations in some sort of way. We always thought we had a grasp on how the world worked, and then something like this can slow things down so tremendously that you can't really rule it out of the realm of possibility. I do remain an optimist. I think that's how you become better as a person and an athlete. So I'm optimistic that the games will be next year. As of right now, they have not been canceled or anything like that, and I think that it's a little bit too far off to know for sure. So I think things are leading in the right direction. The numbers are getting a little bit better. So hopefully they can keep declining, and we'll have the games next year.
Yeah, we'll let you get back to practicing there in your backyard.
Thank you.
Alex, thanks so much for joining us.
Yep, appreciate it.
What a great guy.
Yeah, that was amazing for him to join us. I love that he showed off the little cement circle that he had poured in his backyard just so he could keep training.
Yeah, I know we've heard stories, and we'll be bringing them to you over the next few weeks, of a lot of different athletes that have done that, built entire systems in their backyard to totally bring their training
It's
home.
almost unbelievable that they can do that, but they've got to do what they have to do.
Yeah. For sure.
Well, we also want to talk about some of the other athletes that are going to be featured in the games. They're going to go compete still. They want to. They're striving for that. There's a man named Adam Baloo, and he is a two-time Paralympic game player, and he plays soccer and was diagnosed with cerebral palsy when he was a child. But his recent battle with coronavirus makes his story one that needs to be told right now. And one of our reporters, David de Guzman, he interviewed Adam Baloo, who is in Spain at the moment. He was recovering from coronavirus, had contracted it there, and he talked about it. So I want you to see this story, and we'll come back and talk about it afterward.
Spain has been in total lockdown for weeks, testing Baloo's mental strength.
It's been super surreal, but I will say that mental toughness and that just being physically fit as an athlete helped me prepare for this. I don't think if I wouldn't have gone through coaching, like sports psychology and things, definitely played a role in me, like being able to be okay mentally here by myself.
Slowly, restrictions in Spain are being eased. But as Baloo watches portions of the United States reopen from an ocean away, he thinks it's happening too fast.
It blows my mind. Blows my mind. People are going to continue to suffer, and people are going to continue to die if we don't control this thing. It's not like this thing doesn't discriminate. And I've seen protests from different states, people gathering together to protest the fact that they're being shut down is absolutely asinine to me.
And Baloo has reason to be worried. His mom is a nurse, and his dad has severe asthma.
If my dad were to get it, he would have a really rough time with it. It was hard watching it because I knew it was coming, so I was just trying to warn people. But this is an extraordinary time, and I think it calls for extraordinary measures.
Again, that was an interview with Adam Baloo. He's a Paralympic soccer player for the U.S., and he's working there in Spain and got coronavirus and recovered from it. So his perspective is one that should be shared, I think.
Yeah, definitely interesting perspective. You've got a lot of athletes who are completely healthy, obviously have not gotten the virus, but they're still saying, social distancing is number one. We need to think about people's health, and then to actually hear from somebody who has recovered from it himself and saying, people saying, let's get back to life as normal is asinine, to use the word that he used.
Yeah. And Aaron, you had talked to another athlete as well that was one closer to us here in Texas.
I did. So I've been reconnecting with a lot of the athletes who I started to build relationships with for the 2020 games, and one of those athletes, Murphy Bromberg. So she is a synchronized diver. She's a student here in Austin at the University of Texas, and one of our photographers here at KXAN and I had gone and gotten some video of her training down at the pool at UT Austin months ago. She had her perfect timeline, Will. She is still set to graduate in May virtually from the University of Texas. And
Wow.
so she had planned to build up for the 2020 games, make it to Tokyo, and basically do that, graduate from college all at the same time, and then go on to real life and move into the professional world. Of course, all of that out of the picture now, because she has made the decision that she is going to continue training for the Olympics for another year, and that was a big decision to come to. So I sat down with her at the computer, like we have been doing so much recently, and had a conversation about what the last few months have been like, and then what the future looks like for her as she wants to prepare for 2021. How would you summarize what the last few months have looked like as you were preparing and then learned of the postponement? What was that experience like for you?
When that news came out, I mean, I was crushed. It was hard. It was a hard pill to swallow, just to know that, you know, I had a big decision to make, and was I going to be able to mentally continue on my journey? The way that I explain it to a lot of people is that when you're an elite athlete, you live at such a high level. You know, you're constantly monitoring all areas of your life. Your training, your sleep, your eating, your working out outside of training, just everything. So when you live at such a high level of life that everything revolves around your sport, I think the way that you're able to do that is by having end dates and goals. So for that end date to be just taken away was just kind of like a huge, like, hunch to the stomach, like a big now what? And of course, you know, we have somewhat of a break right now with staying home. So it is like we're not so high up here anymore. But yeah, I do think that it is a really hard thing for every athlete to hear. Yeah.
What does stay-at-home life look like for you once the brakes were pumped and everything came to a screeching halt? How did you handle that? Are you continue training to some extent? How do you keep yourself motivated, even mentally?
Yeah. I mean, mentally for me, I think was the biggest part. That's something that I've always worked on, is having good mental health. Because in 2016, like, my mental health was not where it needed to be. Life was so surrounded by surrounding of diving. But my life was so capable of diving that my mental health suffered from that. So that's definitely something that I've been trying to pay attention to. And for the first week and a half, maybe, I just was like, whatever, I'm not working out right now. You know, I went on a lot of walks. I did stuff that made me happy, like rollerblading, just, you know, workouts to be happy and have fun. And I was thinking about it, you know, I talked to my coach a lot, and ultimately I decided that I would not be able to live with the decision, really, or that's a little extreme. I would not be happy with the decision to quit diving early. I think that if I had chosen to retire and then got to 2021 when the Olympics did happen, I would just have such a hard time watching it and knowing that I could be there, you know, and kind of gave up. So once I kind of wrapped my mind around, okay, this is the situation, this is what's happening, training was a little bit easier to get back into. You know, I'm really lucky that I still have all the resources from Texas. So our trainer, our weight coach is sending us workouts to do every day. So I'm doing those. And then my coach just a couple weeks ago dropped off a couple mats. So I finally got like a folding mat and a landing mat, so I can do jumps and skills there to remember some of the actions. But aside from that, yeah, it's just like working out to have fun and trying to just stay in shape and ride this thing out.
What will the next few months look like once you're able to get back into the pool? When's the last time you even stepped foot in a pool?
Well, we have a little kiddie pool outside, so can't dive in there, but that's been fun. No, but I mean, over a month now, I think. Right when the Olympics, when the Olympics were announced that it was postponed, I was in Midland, Texas. Their pool there was still open, so I was training there. So I guess on that day, I was like, if this pool's staying open, great. I got to get home. I got to be with my people and like process this all. So at least a month now, I think.
I can't thank you enough. We're going to continue cheering you on for 2021. I had asked her, Will, to send me a picture of that blow up pool. She probably has a lot to do, so she forgot. But
Correct,
I
yeah.
saw it on her Insta story on Instagram. It is a blow up blue pool, and 2 of her roommates. She's still living here in Austin
Wow.
in an apartment, and they were hanging out, drinks in hand, trying to cool off. It's been almost 100 degrees here, and so
Enjoying the day, yeah.
yeah, she can't dive in it, of course. But you also got excited when she mentioned that she's been rollerblading.
Yeah, that's been something that I've picked up in my kind of social isolation. There is a giant parking lot near where I live, so I can go there and skate for hours on end by myself, away from people. So it's really nice. So I loved hearing her that's one way she's trying to keep in shape.
Yeah, you're doing the same thing as an Olympic hopeful.
Right. Just so much alike, right?
Yeah, for sure. Also, Murphy is from Ohio, so I believe her parents may be watching this morning. So she's got a fan base there too. And one of the 7 reporters going to hopefully Tokyo 2021 is from Columbus, and he's a reporter there. So he's been following Murphy as well. So I was really excited. Murphy, thank you for taking the time to sit down and give us a window into your world right now.
One thing that I thought was really interesting in what she said is that she didn't want to give up that dream. Mm-hmm. She thought about it, but is not going to.
Yeah, she actually thought about sitting there watching the 2021 Olympics from home and couldn't really stand the thought of that and knew she had to continue trying to go for her dream.
Yeah, dedicated for sure.
Yeah.
We have one more story we want to bring you, and this is from our good friend here on the stream, Jack Doles. He's from Grand Rapids as well, as well as Alex Rose, who just joined us not too long ago. He's talking to a boxer, though, named Joe Hicks, who's doing some training himself to keep up his training regimen for the Olympics, and he's doing it in his mom's basement. So we wanted to share that story with you all. So enjoy this story from Jack Doles.
This is Joe Hicks' new normal. When you look at that treadmill, you come down these steps and you see that treadmill. What do you see?
My best friend now, my new best friend.
Just like he's been doing for years, Joe works out every day after work. Only now, thanks to coronavirus, it's in the basement of his mother's home.
The more I go outside, the bigger risk I have of getting it. So I read that the virus can have long-lasting damage to your body once you get it, and I want to prevent that as much as possible.
For a guy who's used to being surrounded by trainers, coaches, and teammates, this is a big adjustment.
It's very difficult. You got to find motivation somewhere. I'm self-motivated, but I do find days where I'm like, it's the same thing over and over again. But I always think the competition didn't stop, and when the world stopped, it doesn't just stop for you, it stopped for everybody.
His biggest form of motivation comes from his current workout partner, daughter Ariel. He made a promise to take her to Tokyo for the Olympics. So the decision to put off turning pro until afterward, well, that was an easy one. Is there any part of you that would skip this to start fighting as a pro and start to make some money?
So I'm not in boxing for the money. It's strictly love. It's strictly the love. Of course, a nice paycheck is awesome. I feel like for anyone that decides to go pro, you still got to wait because nothing's being done with this coronavirus going on anyway. So by the time you do get your first pro fight, you'll be like, man, I should have stayed on the Olympic team. Until the gyms are open again, Joe will endure the grind and continue to put on mile after mile on his new best friend. How much of a love-hate relationship do you have with that thing? I don't think there's any love anymore. I don't think there's any love left.
I think the one thing that we've seen in all these stories, hearing from the athletes today, is that they are still keeping at it. They are not giving up. They are still going at it.
Yeah, whatever it takes, getting the equipment going at home. I love the videos that I've seen, not just from Joe Hicks, but other Olympic hopefuls with their kiddos, practicing at home.
So cute, yeah.
I mean, she's probably training for, 20, 30 something?
Way down the line. She was so cute.
She's in better shape than me for sure. And I want to know more about that suit, too, that he was wearing. trend, so I'll have to look that up.
What was up with that? That was kind of interesting. He obviously wears it to kind of be the best he can be at the moment. I just also love that, he found a place to go, and it was his mom's basement.
Yeah, hey, no shame in that.
Exactly. You got to find where you got to go. All right, everybody. Well, that kind of wraps up everything that we wanted to talk about today. We touched on a lot, talked to a doctor, talked to athletes. That's the interesting part, is hearing from them, because, again, their dream was right there in front of them just a few months away, and then that was pulled for the time being because of COVID-19.
Yeah, and we want to continue bringing you these stories. We plan on doing this once a month.
Right.
Is it the first Tuesday
First
of
Tuesday
the month?
of the month, yes.
So we'll warn you and put the teasers out on social media and remind you that it's coming. But we are so grateful that you joined us this morning. Hopefully you took away some information, whether it's in your daily life about social distancing and just mass gatherings in general, or you are an Olympic fanatic like we are and are seeing what's going to happen with all of this.
Yeah, and you guys are still set to go next year. Yeah, all right, everybody. Thank you for joining us. Aaron, thank you for being here as always. We appreciate that, and we thank you all for watching, and we'll see you back here another time. Remember, everybody, to please stay safe and healthy, and if at all possible, still at home. See you later.